Medicaid fraud. But I just have a line of health care. I don't know what you can bring back to your hospital to kind of warn them about. You know, when they send out the
Okay, we are live on YouTube.
Well, welcome everybody to our Older Adult Issues Housing, Health and Welfare Committee meeting today, Tuesday, April 28th. And I welcome all of you who are out there in Zoom land and all of our guests who kindly came tonight to meet with us. Before we get started, I'd like to hear from the guests we have. Maybe they could tell us who they are and where they're from, and then we can move on with the topic. If you start with your name and position, please.
Yeah, thank you, Ruth. My name is Monica Hidalgo. I'm not sure where to look.
Yeah, I mean, that's where the camera is, so. Yes.
Good evening, everyone. Monica Hidalgo. I'm with New York Presbyterian Community Affairs.
Good evening, everyone. My name is Pam Devlin. I'm the Director of Practice Operations and with New York Presbyterian.
Good evening, everyone. Ramandi Thermador. I am a VP of Operations at New York Presbyterian Brooklyn Methodist.
Good evening, everyone. My name is Juan Mejia. I'm the president of the New York Presbyterian Brooklyn Methodist Hospital.
Good afternoon, good evening. My name is Lauren Avelino. I am the Program Director of Community Affairs at New York Presbyterian, overseeing the Brooklyn and the Lower Manhattan campus, and a former Bay Ridge resident for 7 years.
Okay, well, get extra points for that.
There you go.
We were hoping.
Yeah, that's why you brought her, right?
Yeah, absolutely. Hi, I'm Julio Batista. I'm with New York Presbyterian Hospital. I'm with the Office of Government and Community Affairs.
Hi, Brett Greenfield. I was with New York Presbyterian Hospital and with Regulatory Affairs.
My relative.
Yes.
And I'm Josephine Beckman, District Manager, CB10.
Okay, so we're going to hear from you about service changes at NYP. And who would like to speak to that?
I can speak to it.
Okay, so I have the PowerPoint. Should I start it now?
Yes,
Okay.
I can maybe introduce the topic. I can maybe let you know when to change the slides. So just to start, so we are here to present, there's actually a very exciting project that we've been working on for many years. And for those of you that are in the room, we have a flyer that we can distribute, but I'll talk about that in a minute. It's actually a brand new a practice location that we opened about 2 weeks ago. But before we do that, I'm just going to talk a little bit for those who may not be familiar with our hospital, just to provide a little background on who we are, and I think the importance of the role that we can play in the community, and just ensuring that our goal is to ensure that we're always meeting the healthcare needs of our Brooklyn community at large. So just I'm going to cover a little bit about our hospital. I'm also going to talk a little bit about some different initiatives that we have just throughout Brooklyn, and very specifically, we have a beautiful new building that we opened about 5 years ago. So some of you may not be familiar with this. I'll talk a little bit about that building. I'm going to talk about our presence in Bay Ridge, and we have a couple of practice locations that we have here for our community in Brooklyn, and then I'll open it up to any questions. You want to switch to view?
Oh, wait, I'm sorry. I thought that we were doing the right view.
Just go to display settings.
Yeah.
Not sure how they see it. There we go.
Okay, there we go.
You guys see that okay on Zoom?
Yeah.
Yes.
Thumbs up.
Okay,
Okay,
good.
good.
Perfect. So go to the next slide, Lauren. So for those who may not be familiar with our hospital, so our hospital is located in Park Slope. We were founded in 1881, so we've definitely been part of the Brooklyn community for many years. Many of you know that we always measure a hospital by size by the number of beds. So we are a 577 inpatient bed facility. So it's considered a pretty large hospital for bed size. We do serve the broader Brooklyn community. We have many clinical departments, from orthopedics to women's services, pediatrics, oncology services throughout our entire hospital. We have 216,000 ambulatory visits and about 80,000 ED visits. And so our emergency room It's pretty big. It's a level 2 trauma center, and we have adult and pediatric services that we provide and care for within our hospital. On an annual basis, we discharge about 29,000, close to 30,000 patients that are discharged from our inpatient facilities. These are patients that are admitted into the hospital and are discharged on an annual basis. So it's a pretty big hospital, and we deliver about 4,100 beautiful babies every year. And one nice thing that we have, which is not on the slide, is we are currently in the process of renovating our postpartum unit, which is where our mothers our mothers go after delivery. We have over 35 beds, and about a third of them are actually just renovated. So we have single state-of-the-art facility, brand new construction that was just completed. And our goal is to complete the construction of the balance of the postpartum beds in the next 2 years, so that when women deliver babies in our hospital, they'll actually be in private, beautiful rooms. And so that's actually an ongoing project that we can maybe at a future meeting come and update everyone on.
I'm sorry, just give me one sec here.
Yep.
There's been mixed messages about what people are seeing, so I just want to make sure they're seeing the right thing.
Okay. And I can just keep talking. So one of the things that we definitely pride ourselves in is ensuring that we're always providing the highest level of care for our community in Brooklyn. I would say our true north is always our patients and ensuring that we have the best outcomes. So when it comes to looking at our mortality rates, looking at hospital-acquired infections, or many other standard quality metrics that are looked at across every hospital across the nation, our goal is to be a top performer on a lot of those metrics. So we're currently, every hospital gets rated in different ratings, and so we're currently a Leapfrog A rating. A is the best, and so we do pride ourselves in being A-star rating from our quality outcomes, and also a 5-star CMS hospital when it comes to our quality outcomes. And I mentioned that because in order for us to differentiate ourselves as a hospital, it's important that we always provide the best care.
Well, excuse me, what's
Yeah.
CMS?
CMS is Center for Medicare and Medicaid Services. So CMS has different ratings that they use for patient experience scores. They use different metrics that they use for quality clinical outcomes. And so they measure us, when I say us, it's hospitals across the entire country, and they measure us all in what is a standard way across the entire country, so that if you're comparing ratings from a hospital here to a hospital in California or in Washington, it's the same set of measures that we're all made by the same metric. And so we're considered a 5-star hospital, 5 out of 5, which we really pride ourselves in because it's ensuring that we're always following the best standards as it relates to patient outcomes. A great question. And if anyone has any questions, please feel free to jump in at any time. Yes.
Is that like the surveys you get after you see a doctor? Is that where they get that information from?
So the CMS star rating is actually the quality rating that I just mentioned is based off of standard patient data that patients review based off of medical records on the outcomes. Again, it's regarding mortality rates, hospital-acquired infections, and a number of different things. So the 5-star rating applies to that. But very similarly, what you're alluding to is we also have CMS also has what's called HCAP surveys, and these are patient experience surveys. That's a different survey, but patients do get a survey after their discharge. That's a standard survey that every patient gets across the country, and that we're also measured on that for our hospital. Okay. Yes, great question. And again, if anyone has any questions, please feel free to stop me at any time. So if we go to the slide, so we have over 60 outpatient practice locations. These are doctors' offices that we have throughout Brooklyn. I'm going to talk about one in particular, but we do have over 60 in Brooklyn, and our goal is to continue to add doctors' practice office locations, just to make sure that our Brooklyn community has access to our physicians, not just in Park Slope, but really throughout all of Brooklyn. The Center for Community Health is the building that you see on the image here. That's what we commonly call a CCH. This is a freestanding ambulatory, which is an outpatient building that we opened 5 years ago in 2021. Within this building, we have many doctors' practices. So the floors 1 to 5 are a lot of doctors' offices. We have cardiology services in here. We have women's OBGYN services, a lot of surgical doctors. On the 6th floor, we have all of our cancer services, including our cancer practice visits. We have a beautiful state-of-the-art infusion center where patients are able to get their chemotherapy services on that floor. Yeah, so it's a beautiful facility that we want to be sure that we have things located here in Brooklyn. And our goal is to provide care within our hospital so that patients within our Brooklyn community don't feel like they need to leave the borough of Brooklyn to Manhattan or elsewhere to get great care. And so we're continuing to invest a lot in our facilities and probably equally amount on our high quality physicians that we're continuing to recruit
So
and grow.
where is that facility?
That facility is located literally across the street from the main hospital,
Oh,
in Park Slope. So it's a building right across the street from the hospital. They again opened 5 years ago.
Is that 5156 Street?
5166 Street.
515. Oh, yeah.
515,
Yes.
sorry. Pam manages most of that building, so I'm sure she's keeping me honest on the address. We're also considered a level 2 trauma center, which means that any traumas that occurred within our catchment area, whether it's a car accident, if somebody falls and trips, if somebody injures themselves, God forbid somebody is a gunshot wound patient, all those patients when in an ambulance, they'll be brought to our emergency room. And we have all the services necessary to care for those patients within our hospital. And there's very specific criteria to be a level 2 trauma center. We meet those criteria in our hospital. We also have a mom and baby mobile unit, which goes out into the community for patients that are not able to get to our hospital, patients that may not have access to primary care, OBGYN. And so we have that goes out to our community. We also have a sexual health mobile medical unit that also goes out, and these are free services. Oftentimes when we have community events or any other events, we bring out these buses so that in the community, patients have access to our services. And we also have a pretty robust Brooklyn Cancer Services Screening Program, which is connected to our bigger cancer services program, just to ensure that patients within our community have access to cancer services. Yes.
With Long Island College Hospital closing their pediatrics or wherever, I forget the name of the department the baby's for. Did you guys inherit all that? Like all the people that would have gone there, go to your hospital? Because one big problem at Long Island College Hospital was a lot of women went there the day they were having a baby, no prenatal care.
Mhm.
And that ruined the hospital.
Mhm.
At your facility, with the mobile unit, are you seeing a lot of patients or?
So no, with the mobile unit, our goal is if a patient comes into the mobile unit, and I'll have Lauren can talk more about it. If a patient does not have an OBGYN, our primary goal is to connect them to a doctor. So that when they leave the mobile unit, hopefully they'll have a prenatal doctor they can have where they have prenatal care services, so that they don't show up to our hospital or any hospital without prenatal care. And the goal is to connect them to a physician through the duration of their
Yeah,
pregnancy.
is that going back for you?
True,
Yeah.
but probably more importantly, from a quality safety
Yeah.
perspective,
Yeah.
it's very unsafe when a patient arrives into our hospital.
Mhm.
If they don't have prenatal care services and if they're ready to deliver, and if we don't have a medical record,
Mhm.
we don't know how to treat the patient. And so we will do our best to keep them safe. And so we would consider it a very high risk delivery if they show up without prenatal care in our medical record. For more than the finances, the mother and baby's health is important. So we try to avoid patients showing up
Yeah,
without.
'cause I grew
prenatal
up in
care.
Red Hook, and the, what they used to do then was say, you can't go to Methodist Hospital because you don't have a prior doctor, but you can get into Long Island College Hospital. And my mother was a nurse at both, and she just fought with people all the time.
The reality is it's actually illegal for any hospital to turn away a patient that shows
Oh,
up.
no, they wouldn't go there because they just would wait till.
Oh, got it. Yeah. Yeah, we try to avoid that again. From a patient safety perspective, it's not good for a patient to show up to a hospital without prenatal care. And this is where I feel like I almost feel like Lauren should be doing this slide, but a lot of the work that Lauren does in the community, Lauren leads a lot of amazing community programs throughout the year. We go out to Brooklyn. So here highlighted on the slides, we've had over 276 community events that have impacted over 9,500 people. And our goal is to continue to add and grow our community events so that the community has access to our education and our different providers that are in the community. We also provide a lot of financial support to organizations that may need support, and we provided over $835,000 in financial support to 50 community-based organizations, and this is specific to Brooklyn, Lauren.
Correct.
So these are for Brooklyn community-based organizations. We've also provided $40,000 of in-kind donations to the community when in need. And so our goal, as much as we pride ourselves in the work that we do within the four walls of our hospital, the work that we do outside of the hospital is equally important. This is just a reflection of that. So very specifically in Bay Ridge, so we currently have two, this is mainly what we're coming here to talk about. So we have two practice locations that currently exist. So to the far right, we have a location in 9,000 Shore Road. And within this practice location, we have cardiovascular services, we have midwifery services for women who are seeking to have babies, we have primary care, pulmonology, and urology. So this is a practice that currently exists. It's a decent sized location, and our goal is to continue to grow that practice. On the far left, you'll see what's called Leros on the address of 8721 Fifth Avenue. Within this practice, we housed bariatric surgery, primary care, and cardiovascular. What we've done is we've actually opened a brand new state-of-the-art facility. So the one in the middle, our new Bay Ridge facility opened 2.5, maybe 3 weeks ago. Located just a block away from the Leros facility. So what we did is we migrated all the services that were in the Leros facility, and we moved them. We moved the staff, the doctors, the patients to the new multi-specialty facility where we have cardiovascular, digestive services, including bariatric surgery, OBGYN services, orthopedics, primary care, and many different surgical subspecialties. And so the reason we're doing this is we really ran out of space in the current location. I'm hoping you guys will able to visit our new location at some point. If the community board ever wants a tour, we can definitely give you a tour of that space. And so it's a much nicer state-of-the-art facility, and it's really an upgrade to all of our patients. We take the same insurances as we did in the previous location to the new location. All of our staff moved over, and all of the bariatric surgery, primary care, and cardiovascular physicians that were in the previous location have also moved, and we've added additional physicians for the rest of the services. And we've actually added an additional 41 staff that are part of the facility because it's a much bigger practice location.
It's huge.
It's huge, and I have some images. Yes, so if you go back one, we went from 5,500 square
Yeah.
feet, and we moved into a facility almost 3 times, or from more than 3 times the size, which is 6,500 square feet. So much bigger services for our community here in Bay Ridge. So we have some pictures just to familiarize. This is the old location, which you guys all might be familiar with. This is the Leros facility. If you go to the next image, these are images of the old facility. So it was a little dated, older. And we definitely upgraded to a much nicer facility. The next image, this is the new location. You guys might be familiar with the old TJ Maxx location. So this is taking place. It's been closed for a while. So we are located on the 2nd and the 3rd floor of this building. As I mentioned before, we have cardiology services, including echo, stress testing, vascular, and nuclear cardiology imaging. Digestive services, including GI, weight management, which is the bariatric services that I mentioned before. We have endocrinology. So look here, that thing is covering. It includes diagnosis of diabetes, thyroid conditions, and other disorders. Full OBGYN services. So we have a lot of expanded OBGYNs that are there, and they will be seeing patients there for prenatal care. Obviously, patients that are seen there will deliver in the hospital when they're ready for delivery. We are adding orthopedic surgery, which we never had before. And so we're adding, there's a pretty big practice of orthopedic doctors that are moving there. And we have x-ray services on site. So if a patient breaks a bone, they need to see an orthopedic doctor, they can get their x-ray within the same visit. And we have a number of different surgical subspecialties, including general surgery, bariatrics, colorectal surgery, and vascular surgery. And our goal is, we just opened this location, as I mentioned before, just 3 weeks ago. And we've treated, I think the first week was over 150 patients, and it's 2 floors. Here's a couple of images of, on the left, you have our stress testing location. The middle is a CT scanner, and on the right, it's just one of the staff reading some of the images that are on there. So that's the information that we wanted to present. Again, we wanted to just talk about our hospital within Brooklyn, talk about the exciting news of the new location that opened a couple of weeks ago. The shift from the Leros facility to this new location, and we're happy to take any questions that anyone might have.
Well, congratulations to all of you, to the hospital and the leadership. It's really very impressive to see the services and the growth. And it's exciting. I'm really happy you came because as a longtime Brooklyn person, I certainly know Methodist Hospital. As a matter of fact, I worked at John Jay for a while, so I really knew it. But it never had this kind of expansiveness, so it's really good to see. Thank you.
Good, thank you.
Well, I think the best thing about it is the amount of services in one building. Because I've been in Bay Ridge 40 years, and there was a doctor here, a doctor there. I worked in the city, I saw doctors there. I was
Yeah.
scattered. Don't get mad, but I'm primary NYU and I'm outside because of the 9/11 responder. But the minute I saw this, I was like, I can't believe this. Because I deal with a group of senior women
Mhm.
and because their doctor may say now because of their age, you have to go get this test or this. And they still see an individual doctor who's maybe affiliated with a hospital or maybe not.
Yeah.
So now they have to go into the city or different things. And I have made it a mission to try to convince them. You have NYU, now you have this even closer. The more you have in one building or one hospital network makes the biggest difference. Because with Epic, you don't always see other charts from other facilities. Like I found that out the hard way a few years ago. And so I had to always remember what the doctor gave me, the after visit thing, and bring it to somebody else. And the my charts make a big difference. But just because of their ages, having the cardiology and all these other things, it makes life so much easier.
Yeah.
Now, I don't know yet if they've gone there, but I keep pounding it into them. It makes the biggest difference because I'm reaching a point where I'm getting tired of going to the city.
Mhm.
But I'm telling my primary doctor, if I have to give this doctor up for 15 years, can you find somebody compatible in Brooklyn?
Yeah.
So, because the commute is long. I see a doctor for 15 minutes, but it's taking me 2 hours to get there.
Yeah.
So.
And if you were to ask us, like one of our primary goals is to, all our physicians are Weill Cornell physicians, which means that they have the same privileges, the same doctors that are in the Upper East Side Hospital. So we see ourselves as the doctors, many of our doctors actually go back and forth between Brooklyn and the Upper East Side. But our goal is to continue to expand our high quality services so that our community in Brooklyn doesn't feel like we have to travel to Manhattan to get high quality care.
That makes a big
So
difference.
yeah, especially for patients that are getting recurring visits, like so if someone's a cancer patient and they're getting infusion services, oftentimes those patients have to see a doctor, get different services numerous times a week. Or if someone's having a baby, it's actually much easier to have prenatal care, but almost in your backyard versus having to travel far for that. So that's our goal. And maybe one time we'll come back. We're actually looking to expand even further in Brooklyn to open more locations, and we'll come back to a future community board to talk about
Well,
that as
people
well.
were there with the TJ Maxx clothes. They were like, oh, I can't believe it.
Yeah.
But this is like a big plus. Some people may not realize it yet, but it makes a big difference. The only thing I would say is maybe put your hours on here.
Oh, yeah.
Yeah.
Good suggestion. We'll definitely do that.
I don't know if there's any questions on the Zoom.
Yeah,
or- Yeah, we can actually, I can,
do the stop share.
yeah, let's do that.
Thank you. Appreciate it.
No, right.
There we go.
Everyone's-
Great, no, thank you, everyone.
They-
Julie, did you have a question? Did I see your hand raised? No, okay. I was quite a distance. So does anyone on virtually have any questions for our guest tonight from New York Presbyterian? I don't see any, no questions.
Is that just board members? And after that, you could ask
Right.
for the.
Anyone from the public have any questions? You could raise your hand on your hand raise feature. I'd like to introduce Gail Karp, who's here. She's an ambassador from the Bay Ridge Center. Gail, welcome. If she could hear me. I know she's a new ambassador.
Oh, great. Very
Yeah,
nice.
to Community Board 10.
Uh-huh.
Yeah, I think the best, from the, Community Board District Office, we hear, we work with many CBOs and, different communities, in need within our, district boundaries. And, having the, new services that will be provided here at the convenience, centrally located near the, transportation, the R train, and not have to trek either to Park Slope or to Manhattan, I think is very exciting for many here. We've partnered with other hospitals over the years to do community outreach events. We recently participated and partnered with the baby shower for women in need in the community. And I know other parts of the district have also done that as well. The demographics have changed in the Dyker Heights section of the district, and there are a lot of more and more families in need, and we enjoy working with, all of our healthcare institutions and providing, certainly, we're willing to share information to the community and provide information out there. We have a health community needs survey that comes out by the Department of Health. We take that seriously and try to do preventative care, which next we have someone here from Department of Health, but we do like to partner with community on a host of different health
And we have
needs.
a resource guide for
Yes,
older
adults.
adults every year.
Ooh, that's great.
It, people really like it because it has discount at local stores. But it also has things like where you can get all different kinds of services, so you should definitely be in it for
Yeah.
next year.
Yeah, we'd be happy to do that and also happy to partner with the community board, any local CBOs, the baby showers or getting out health information. We have a speakers bureau at the hospital. We leverage our healthcare experts and talk on a number of topics. It's something that Carmen and I spoke about. Visiting centers, so we're very happy to do that.
We also are a community that has a lot of like big public events, like we have a Fifth Avenue Festival, a Third Avenue Festival.
We're sponsoring both.
Oh,
you know,
yeah, well, you're ahead of us already.
Okay.
Yeah, so we'll be at the summer strolls on
Oh.
Fifth, we'll be at the Fifth Avenue Festival on the 31st, and the Third Avenue Festival as well.
Well, there you go.
Lauren always makes sure we're at all the
I mean,
festivals.
I have Bayrich has a special place in my heart, so,
Well, we have a very good BIG,
yes.
so
Right.
that's where you can get all your information. Well, she's on a different committee.
I'm
That
connected
was
to
a-
Elizabeth
Elizabeth,
Lopez
that's
right.
and,
right.
John Vamas and all the people, so
Yeah.
we're,
So why did you leave Bayreuth? They have things to do.
I had a baby and I needed
Oh.
more space.
Oh,
So
those
we crossed the
babies.
bridge.
Oh, you went to Staten Island.
My husband's from Staten Island, I know,
Has a pull, definitely does.
yeah. Sorry about, coming back, we had dinner at Gino's before, like it was nice to be back in my old stomping grounds, for sure.
Yeah, great. So we'll definitely look for you at those things.
Yeah.
I met Lauren at the baby shower, and I gotta admit, I like when I meet somebody and I like them right away. And it was just hectic, like I wanted her to come to speak at the Salvation, it was about maybe 25 of them. And sometimes things don't work out then, but I'm sure at some point, she can come back, she can come and talk to them.
Yeah, that'd be great.
Yes, Carmen has many, many networks.
And
Yes.
Josephine has a great window to put that in.
Yes.
Oh, wonderful.
Definitely. We have a community news bulletin board on our front window, and we have dozens of people come into the office, looking for information or needing help or referrals, whether they're, we have everything from victims of domestic violence to just people, who have community service complaints.
And your
So,
newsletter that goes.
and we have a monthly e-news blast with about close to 3,000 subscribers, with a very good open rate of about 70%. So we have people who are very much engaged.
Or email blast.
They-
That would give you an idea of what's happening in this area.
Yeah,
Yeah,
Bay
they
Ridge is,
When you are-
yes, Bay Ridge is very, very engaged, yes.
Of course.
Okay. All right.
Well, we're impressed.
Thank you.
Appreciate it.
The only thing is we want to stay healthy, so we don't need any of your services. I know there are a lot of preventive services.
And we have primary care.
Okay, very good. All right.
Okay.
So Ruth, we have Samantha Williams here next on our next topic. You're all welcome to stay or up to
Is she
you.
on Zoom?
She's on Zoom, Samantha Williams, right? Hi, Samantha, how are you?
Yes, hi, good evening. How are you?
Good, good. So are you ready to go into your presentation tonight?
Yes, let me just share my screen. And all right, could you guys see the screen?
We see the screen, but not a slide yet.
I'm feeling the squirrely thing. Spinny thing.
Wait, could you see it now?
Ah, here we are.
Okay, yes.
All right, so hi, I'm Samantha Williams. I'm a public health physician with the New York City Department of Health. I work in the Bureau of Chronic Disease Prevention as a medical advisor, and we work very closely with the cancer team. Checkwell, or the Center for Health Equity and Community Wellness, is our division. So today we're going to talk about lung cancer screening and prevention. First, what do you guys know about lung cancer?
What do we know about it? We don't
Why?
want it.
Yes. We know that
Yeah,
smoking is a big factor,
Vaping.
and vaping, which are two issues in the community that we have been, which is why we selected this one, because we do have concerns about young people in the community vaping and our high smoking
What was
rates.
the hospital that spoke, was it NYU that spoke about vaping?
Yes, we had a physician from, yes.
Two physicians from NYU about vaping. Oh my God.
Yeah,
Oh, wow.
we've had some parents come in concerned about the number of smoke shops that are opening and vaping.
And the parent who came in with the son who was hospitalized for an
Hospitalized.
infection.
A fungal infection of the lungs. So we thought this was good to be a good public service aid to, from the Department of Health, because we have those concerns. So,
And thank you. Yes, smoking, definitely. Vaping, I can try to find out if vaping's tied to lung cancer. I wouldn't be surprised, but I don't know if the research on that is too new, but I could look it up and get back to you about that. But smoking, yes, definitely. But there are some things we can do to prevent or to help reduce our risk and detect early. So I'll get into that. I guess maybe if you want, we can do questions during the show or at the end. Well, first we're going to talk about what is lung cancer. So cancer in general is a disease in which some cells in the body grow out of control. And when cancer starts in the lungs, it's called lung cancer. And lung cancer begins in the lungs, but it can spread to the lymph nodes or other organs in our body, such as the brain. And then here we have some anatomy of the lungs. I don't know if you can see my mouse, but when we breathe in through the nostrils or through the mouth, the air goes through the trachea, down the bronchi, the right and left bronchi to the lungs. And then in the lungs, we have these things called alveoli, which absorb oxygen in our bloodstream and release carbon dioxide when we breathe out. Just a couple of stats. So this is nationally. They estimate about 1 in 17 men in the US will get lung cancer, and about 1 in 18 women will get lung cancer in their lifetime. And these numbers include both people who smoke and those who do not smoke. The lung cancer risk is much higher for those who smoke, about 15 to 30 times higher. And about 80 to 90% of lung cancers are related to cigarette use. However, certain research is showing, up to 20% of lung cancers have nothing to do with cigarettes. And, there might be a couple of reasons, which we'll get into, but some things we don't know of the direct causes quite yet. So now we're going to talk about who gets lung cancer. So this is a map of the city. Throughout New York City, there's about 4,300 cases each year. And lung cancer is more common, or 4,300 New Yorkers get lung cancer each year. Lung cancer is more common in older adults, especially over the age of 65, but it can occur in younger adults as well. It's extremely rare in children. There's less than one case per 100,000 people in those under 18. in the city each year. So, so this map shows lung cancer incidence rate, which per new cases for 100,000 residents. So incidence is new cases. So the dark blue has the highest incidence. So this is saying in the very light blue, there's between about 24 and 29 new cases per 100,000 residents. And then
We're
the dark blue has the higher incidence. So we can see,
Pretty dark.
oh,
We're here, yeah, in South Brooklyn.
Brooklyn.
We're in the
Yes.
44.81 to 55.7.
Yeah.
A little scary. Yeah. So now,
Okay,
yeah, did you
so-
see that?
Yeah,
It's
so it's
coming.
relatively
Up on
high,
me.
but yeah, but not as, yeah. Yeah, it's, but not too, but as we, though Staten Island has the highest incidence rate, as well as maybe some parts in Brooklyn. But you know, we think well, we know like Staten Island, they have a higher percentage of people who smoke, so that could be possibly why. Okay, so this was from 2018 to 2022.
There's also in Staten Island, there's been studies done about the incinerators in Staten Island, the garbage dump, that had a lot to do with that, and some of the industrial base in Staten Island.
Yeah, I wouldn't be surprised about that too.
A little better,
yes,
yeah.
we know
Their cancer rates are more than just lung cancer too. It's really bad.
Yeah, you know, I wouldn't be surprised. I know certain forms of air pollution can increase the risk of lung cancer as well. I think PM 2.5, but I could get back on that exact. Okay. So now we're going to talk about mortality. So similar, these are the deaths per that are age adjusted between 2019 and 2023. So we lose about 1,800 New Yorkers to lung cancer each year. So those who are diagnosed with early stage lung cancers, meaning it hasn't spread too far throughout the body, have about a 64.75-year survival rate compared to the general population. And then lung cancer that's spread to distant areas is more difficult to treat. The relative survival rate for those diagnosed with distant lung cancers is only 9.7%. So as we can see, there are a couple of inequities throughout the city. The darker shades show the higher mortality rates. You know, according to this map, are located in Staten Island, Central Harlem, certain areas in Brooklyn, but Staten Island especially.
Well, again, this is us here in the very dark green.
Yeah.
Right here. Yeah, I'm sorry, we have a question, Carmen?
Yeah.
I just want to point one thing out. In Staten Island, they have a high number of first responders from 9/11 to the point that Mount Sinai actually they opened an office there so that they wouldn't have to commute into the city. And with the lung cancer with these people, like the last 25 years, it could manifest in some people very early, some 20 years later, some 22 years later. So that's why you have a high percentage there, because that was one thing they knew right away. There was a high percentage of first responders that came from that lived in Staten Island. So unfortunately, that's probably why the dark green. Yeah.
Bay Ridge also.
Well, thank you. Yeah, I didn't know that, but yeah, that makes sense too. Yeah, I mean, it could be a mix of factors as well, but I didn't realize. But so now we have. I'm sorry, the numbers look a little weird, but this is people who are diagnosed with lung cancer or incidence versus mortality, those who are diagnosed versus those who died. And this is an overall for males and females combined across the city, then divided or stratified by race and ethnicity. So the bars on the left show the incidence rates, and the ones on the right show the mortality rates. So we can see who's dying at a higher rate or who gets the cancer more often. So from these, we can see the highest incidence is in white non-Hispanic New Yorkers, represented by this blue. Although Asian Pacific Islander non-Hispanic is a very similar incidence as well. This is 48.5 and this is 47.1. And these numbers are per 100,000 people that are age adjusted, which means the statisticians try to make it so that age really isn't too, like if there's wide differences in age, they try to make it so that it doesn't pull one group more so than the other. So the incidence is the lowest in Hispanic New Yorkers. And when we go to mortality, it's similar in Black and white New Yorkers, slightly higher in white New Yorkers, and not to an Asian, and similar to the overall, and Hispanics have the least mortality. I guess we can talk about this a little more, but though relatively compared to the incidence, Black New Yorkers might have a higher mortality because their incidence is a little, like somewhat lower, but mortality is almost the same. And Asian New Yorkers might have a little bit of a lower. This is 17.9. But now then they divide it by males and females. So from this, the left shows the incidence rate for males, which is the rate of males being diagnosed with lung cancer. Within the male population, Asian Pacific Islander males have the highest incidence or new cases, I believe, and this is 58.9 per 100,000. Then the bars on the right show the mortality, which is the rate of men dying from lung cancer. And then though Asian Pacific Islander men have a higher incidence, Black non-Hispanic males have the highest mortality, which might signify an inequity, whether that be access to treatment or care. And I mean, something else that shows that like lung cancer, a diagnosis is not necessarily tied to mortality, like though the incidence might be higher in certain groups, like the Asian population, the mortality isn't as high, so it is treatable. But you know, as you know, I was saying before, there could be a disparity, whether that's in treatment access or other factors. And then something the health department does is look into these factors when we notice disparities and try to mitigate those. And this is female incidence and mortality, which has a somewhat different pattern, though this is similar to the first graph we saw of NYC overall. So the highest incidence is in white non-Hispanic females, lowest incidence is in Hispanic females, then as well as mortality, and the highest mortalities in white non-Hispanic females.
Samantha, I have a question. And I
Yes. Yes.
DOH has partnered with the Asian community on some studies. Like a few years ago, MSK did some work with taxi drivers. They found that they smoked heavily. There was a high incident rate. And they did some outreach in the community, and they were able to actually put them on studies, etc. Just curious about what the DOH has done around some of these data points.
Yeah, so there might be people at DOH who know more than me. I started under a year ago, but I can look it up and get back to you. The question was specifically what the DOH knows about studies that MSK has done with the Asian population and smoking.
It's MSK, but what are they doing about some of the data, right? Based on what we're seeing, what are some of the interventions or partnership opportunities? And, you know, we also, part of the oncology practice or have oversight of some of the oncology practices would be happy to partner with the DOH if the opportunity presented itself.
Oh, okay. And so you guys, well, NY Presbyterian Brooklyn, you said you'd be happy to partner with DOH if there was something.
Yes.
Okay.
Yeah.
Well, that sounds great. I'll yeah, and I can just I guess just tell you I'll let the cancer team know, and my boss, she's the executive director of our unit and the cancer as well. She's on vacation, but I'll let her know, and I'll let the director of cancer. I don't know if you guys know Adrian, but I'll let her know and her team know as well if there's anything going on. But thank you. Okay, so next we have the smoking rates. This is another map of this, basically has the age-adjusted smoking rates for adults 18 and over. It's a couple years behind, but research, normally takes a couple years. So this is 2021 to 2022. The darker blue shows the higher rates of smoking. There's a couple areas. The statisticians looked at this by community district. So the highest smoking prevalences were in Stapleton, Port Richmond, Williamsburg, Fordham, and the Bronx, as well as this Crotona Tremont area. Overall, the smoking rate is 9% among adults in the city, 18 and over. The smoking rates greatly vary overall from about 4% to 17%. And then it's also important to note that geographic differences and community factors can be protective in preventing use or promoting treatment. And different neighborhoods might have different retail environments. And when I say retail, I mean density of tobacco retailers or advertising. Disparities in tobacco use exist among the neighborhoods, sometimes due to more aggressive industry marketing, which tends to happen in Black and Latino communities, including menthol tobacco products. And in certain areas, there was a wide confidence interval, but
again, Samantha, our smoking rates are higher than, I think we'd like to see them from this chart again in South Brooklyn. Okay, so you can
yes.
go to the next slide. I just wanted to mention that.
Yeah.
Something that we're aware of at Community District 10, and then we've been working on some outreach too, here.
What are some things you guys have been doing?
So we've partnered with schools in the past to do educational forums about smoking. We've brought in Brooklyn Partnership, Smoke-Free Partnership, to do informational seminars. We've reached out to all of the key clubs and local schools to have their leadership team show the presentations by panels of physicians of in the area, as well as Department of Health, Smoke-Free Partnership, to really kind of spread the word in assemblies at local schools, for middle schools and high schools, where we're seeing or hearing about concerns about increase in smoking rates. Trying to get that education out there early. So do a lot more preventative work. I think is a lot, and some of our schools have been doing it as well.
Oh, nice. It's the next. So now we're gonna talk about risk of lung cancer. I know you guys mentioned tobacco, cigarettes. We all know, but do you guys have ideas of what else could put you at risk for lung cancer?
Carmen?
Yeah. Oh.
Construction workers, a lot of them.
Asbestos,
Yeah, if they're removing asbestos, they may not have the right equipment, or they may not know how much to take off their clothes or different things before they bring it in the house. And then you have this tremendous push for new housing. And I just had some work done in my building, not I rent, but I know it sounds fancy. And when they had to cut some marble steps, like I was surprised the lengths he went to prevent the person who was cutting the marble. And I said, oh, why are you putting this up? He goes, because all that stuff, when you're cutting it, it's like a diamond cut, it can get into your lungs, and that can cause cancer. And then I kept thinking about all the construction sites I've passed over the years, and none of those precautions were there. So it's like you can get lung cancer smoking, but you can also get it doing like this massive construction if nobody is watching what's going on. And it's almost like, yeah, I'm gonna reference 9/11 again. It's like these people saw the building go down. I'm seeing them go up, and they could almost be at the same risk level. One could have this in their body and the cancer is gonna manifest in a few years. And these people, with the other people, it may manifest even sooner. And that's really dangerous because once it's in your body, it can't be taken out. And lung cancer is just one of the things that can happen. That's like, that would be like cancer number one, and then you can wind up getting a bunch of other cancers. So it's almost like they have to, well, the city probably has to do it, or the state, safeguard like some of these construction workers and send people around to see what's going on, if they're doing the right thing. Because a lot of these materials they're dangerous, and if you hire day laborers, they don't know, like, hey, I'm just putting this glue down or this stuff, and they may not realize how tough they're gonna.
I also heard that all these the new countertop products, the people who install kitchens are at risk.
Yeah.
Because
Those
they
are the
cut
ones.
these sandstone and Pisa stone, all these man-made stones. I don't know if that's more so than granite, but that's what I heard.
Yeah, they're supposed
But
to.
also in general, I mean, just breathing,
Like,
I mean, there are people, you walk down the street, there are people smoking all around you, and, the air is pretty bad. Right?
Yeah,
Breathing on
unfortunately, and I could look up the specific, like the different materials, but yeah, definitely cigarette smoke, including secondhand smoke exposure, could put someone at risk. So smoking, radon, it's colorless, odorless, some houses and buildings, and secondhand smoke. So some risk factors we can't change, but some of them we can. Radiation therapy, exposure to cancer-causing agents. We talked about asbestos, but uranium, arsenic, diesel. Something else which is interesting, but beta carotene, which is the body converts it to vitamin A. So it's in a lot of things with that reddish orange pigment like carrots, sweet potatoes, but beta carotene supplements and smoking actually increases lung cancer risk. I'm not sure why, but according to American Cancer Society, smoking is by far the leading risk factor. Cigar smoking and pipe smoking are almost as likely to cause lung cancer as cigarette smoking. Smoking low tar or light cigarettes actually increases lung cancer just as much as regular cigarettes. Menthol cigarettes might increase the risk even more since menthol allows people to breathe in deeply or more deep. Radon is a naturally occurring gas, usually found underground from the breakdown of the uranium of soil and rocks. But according to the U.S. Environmental Protection Agency, or the EPA, radon is the second leading cause of lung cancer in the country and the leading cause of lung cancer among those who don't smoke. Outdoors, it's so little radon, it's very unlikely to be dangerous, but indoors it can become concentrated. So it's important to get your home tested for radon. Secondhand smoke is the third most common cause. Some other risks include certain dietary supplements like beta carotene, as we discussed. This information comes from the American Cancer Society as well as the CDC. So now we can talk about how to lower our risk of lung cancer. So if you are someone you love smoke, quitting is the best way to reduce the risk. And if one's not ready to quit, there's still options, which we'll talk about in a little bit, but you can see at nyc.gov/nycquits. Reducing secondhand smoke exposure. I know this could be difficult if someone lives with someone who smokes, but some things you can do would be open the windows, walk outside, or maybe kindly ask someone who's smoking to smoke outside. Getting the home checked for radon. Safety guidelines at work. If someone has to work with asbestos or diesel or uranium, making sure they're wearing the appropriate PPE. And then talking to your healthcare provider if you should be screened for lung cancer, which we'll talk about in a little bit as well. So even though not all lung cancers are preventable, smoking cigarettes is the #1 contributor. And even occasional smoking, whether that be cigarettes, cigars, or pipes, can increase the risk of lung cancer. So now we're talking a little bit about tobacco treatment. So the New York City Department of Health put out this toolkit amongst health providers in New York City and patients. There's a quiz, which is called "What's Your Relationship with Tobacco?" I can include the link maybe in an email. But basically it discusses if one's ready to quit, it could assess, and then also some next steps they can take. So tobacco treatment can come in various forms. There's certain medications like nicotine patches, lozenges, as well as coaching. It can help cut back or quit smoking or even vaping and avoid smoking or vaping in certain situations. And these medications, such as nicotine replacement therapy, as well as others, are safe to use, even if someone is smoking or vaping. So how to get treatment medication. Yeah.
I don't hear any mention of pot smoking. Oh, sorry, yeah. I don't hear any mention of pot smoking. Where does that fit in with lung cancer risk?
That is, so that's a very good question. I mean, I would suspect the data on that might be very sparse, so it's hard to say, but I can definitely look it up and get back to you. I mean, there's been a lot of research on tobacco for many decades, so we can say with confidence that tobacco leads to lung cancer. Vaping, relatively new. Cannabis, even though it's not really new, the research might not be as robust as it is for tobacco, but I can look to see if there is anything.
The president just signed some order allowing it to be rescheduled for the purpose of doing more studies on it. But up until 2 weeks ago or 3 weeks ago, it was Schedule 3 or whatever it is, or whatever the highest schedule is, and there was no allowance of doing any research on cannabis by anyone. And that's been not allowed for decades.
Okay.
Guessless.
You know, and thank you for sharing, but yeah, I wouldn't I wouldn't be surprised, like, and I know something else, we're working on anecdotally is cannabis and heart disease, if there's any evidence on that. And, certain studies have shown an association, but it might be too early to say whether it's a cause. But yes, something we can look into, and I can definitely see if there is anything and get back to you guys. So now we're going to talk a little bit about how do we get this treatment and support. So we can talk to our healthcare provider. If someone has Medicaid, it does cover all 7 FDA-approved medications, including nicotine nasal spray, varenicline, which is a prescription medicine, bupropion, an inhaler, a lozenge, gum, and the patch. Medicare covers the nasal spray, varenicline, bupropion, inhaler, does not cover the lozenge, gum, or the patch, and private health insurance might cover some of these. It's important to note that we can use something called GoodRx, which is a prescription discount card, including from local pharmacies. And then this was taken from, so there's a guide on the New York City Department of Health website, and I can include this in a follow-up email. It's called How Can I Get Tobacco Treatment Medications? So if you go to nyc.gov and put How Can I Get Tobacco Treatment Medications in the search box, there's a guide that could help you navigate, it has this chart in it as well as other information. There's also quit lines. Someone's ready to quit, or even if not fully, even cutting back, quit lines are a good resource. So there's one at the state level. New York State has a quit line that provides at least a 2-week supply of combination nicotine replacement therapy with patches and lozenges, along with counseling to almost all adults who smoke or vape. And currently 4 weeks is being offered. New Yorkers can access this directly online or the phone. You can also help someone fill out a form and enroll online. So counseling is provided by phone. After enrollment, the quit coach will make at least one follow-up call, but New Yorkers can also call back anytime. There's also enhanced services, including extra coaching and medication support for their priority populations, which are those who are pregnant, those who have psychological distress, those who have disabilities, those who report alcohol dependence and or use cannabis. And then for those whose preferred language is Chinese, Korean, or Vietnamese, there's also the Asian Smokers Quit Line, where people can access counseling and coaching support in their preferred language. They also work with the state hotline, the New York State hotline, to ensure people can access the same medication and resources, and you can enroll online or via the phone. So there's also several local tobacco treatment programs throughout the city, which you can find on the NYC Health Map. You can filter by various criteria, including availability of free or low-cost medication, group counseling, or support to quit vaping. And then all these are in the Guide to Tobacco Treatment Programs, which is a directory by borough, includes other citywide resources as well. Even though the health map is usually is updated more often. So physical activity. So some studies show that physical activity might help lower the risk of lung cancer or other types of cancer. Certain types, they recommend 30 to 60 minutes a day, 5 days a week of moderate aerobic activity, such as a brisk walk, or 15 to 30 minutes a day, 5 days per week of vigorous aerobic activity, such as a jog, or a combination. Physical activity guidelines also usually recommend 2 days of muscle strengthening activities and some balance activities as well. So now we're going to change gears a little bit and talk about symptoms. So, you know, a lot of these symptoms may seem a little vague. If someone has one or more of these symptoms, it does not mean they definitely have lung cancer. And the opposite is true too. If someone has no symptoms, it doesn't mean necessarily that they don't have lung cancer. You know, many people with lung cancer might not have symptoms until the cancer is in a later stage.
Dr. Williams, can I ask a question?
Yeah, yes.
Yeah, how often do you, or does the health department recommend that healthy people get checked for lung cancer, like have checks, x-rays or things like that?
So we will get to that. Right now, the screening recommendation is only for those who smoke or used to smoke, but we'll get into that. We have slides on screening.
Well, I'm interested in knowing how long you anticipate your presentation continuing for.
Oh, yes, I'm sorry. Yeah, and I'll try to, there's, I mean, the last couple slides are just like true or false, but we don't have to necessarily do that. But there's about like, yeah, there's a good amount of slides. Maybe there's like 10 more. So I can try to either run through it or I don't know. What would you guys prefer? Am I taking?
I think that given the fact that we began at 7 o'clock and we try to keep our meetings, you know, an hour and 15. You know, people have worked all day. So maybe you could send us some of the material
Yeah.
remaining and we could wrap it up. Would that be agreeable?
Yeah, sure. Yeah, I can send you a PDF copy of these slides.
That would be great.
And we could include it in our newsletter.
Oh, for
Yeah.
sure. Well, I think one of the things that came to light from your presentation, for those of us living in South Brooklyn / Bay Ridge, Staten Island, we have an awful lot of work to do. And if we slept well before, we might have a few changes. I think tonight might be a rough one. But what you're presenting to us is just so very important. And I know that there's probably no one in this room who hasn't known someone who's suffered from lung cancer and passed away from it. So it's a big concern for everyone. And I just want to thank you so much for giving us such important information. And we really look forward to getting your handouts. I want to say that on May 18th, we're going to have our next full community board meeting. And this is for you, Dr. Williams, and for our guests from New York Presbyterian Methodist. You're certainly welcome to come to our meeting. And at the beginning of, well, if you come to the meeting, you'll hear me present on this meeting. And if you don't come, you could live stream it and watch it that way. But if you come, we have a public session at, she knows everything. We have a public session at the beginning of the meeting. And you get like 2 minutes, so you have to speak fast. But anytime you want to share a message with our community board, that's another way to do it. And you know, we welcome you.
Thank you. Thank you. All right, thanks.
So thank you very much, Dr. Williams, for your presentation. And I want to thank our guests from Methodist Presbyterian also. And we've had a great number of guests tonight, and thank you so much. Oh, there's Gail. Hi, Gail. Yeah. Oh, and I want to mention, I forgot, that the meeting on May 18th will be at our new older adult center.
Oh, yeah.
On Bay Ridge Ave. I know you're there, right?
No, I'm not. That's great.
But it's if any of you want to see it, that's, one way, or we could certainly arrange a tour for you.
Oh, thank you. That's
Anytime,
very
or
kind
Gail
of you.
could do that.
Yeah. Gail's
She's
the
our
ambassador.
New representative.
All right, well,
Thank you so much.
Thank
Thank you.